Hi everyone, welcome to Perineal Pelvic Health Solutions. I'm Dr. Ryan Bailey, a pelvic floor physical therapist who specializes in pregnancy and postpartum. Today, we're going to dive into a topic that's often overlooked but can be really important in preventing severe perineal tearing during childbirth. Specifically, obstetric anal sphincter injuries, also known as OASI. One recent method that's gaining attention is measuring perineal length during pregnancy to help assess your risk of tearing. So let's break this down. OASI refers to third and fourth degree perineal tears that affect not only the vaginal tissue but extend into the anal sphincter muscles. These types of tears can lead to issues like fecal incontinence, pelvic floor dysfunction, and longer recovery periods postpartum. Recent studies show that measuring the perineal body, which is the area between the vaginal opening and the anus, can provide insight into a woman's risk for OASI. A shorter perineal body has been correlated with a higher risk of severe tearing during vaginal delivery. So knowing this ahead of time can help both you and your healthcare provider better prepare for labor. But since it's not a routine test done, not every provider knows how to do it. But it's a simple process that can be done during a routine pelvic exam by your healthcare provider. And here's how they can do it. The first step is to get you into a semi-reclined position with your knees bent and your legs apart. Then, using a sterile ruler or caliper, the provider is going to measure the distance between the vaginal opening at the posterior fourchette to the middle of the anus, which looks like this. Normally, a woman would need to bear down to place the pelvic floor on a stretch to take this measurement. However, since the pelvic floor is on stretch during pregnancy, there is no need to bear down when done after 35 weeks gestation. Once the measurement has been taken, make sure they record it so you can compare it to average perineal body lengths. Studies suggest that a perineal body length of less than 2.5 centimeters may indicate a higher risk for OASI. And research published in recent years is consistently showing that women with shorter perineal lengths, especially those measuring under 2.5 centimeters, are more likely to have third and fourth degree tears. This makes it a valuable tool for risk assessment. Some studies suggest that these women may benefit from alternate birth strategies, like avoiding lateral episiotomies, changing delivery positions, and being more cautious during pushing phase of labor. If you find that your perineal length is on the shorter side, don't panic. There are steps you can take to help minimize your risk of tearing, like perineal massage. Studies support perineal massage starting at 34 weeks to increase tissue elasticity and reduce tearing. But if you've been following me, you know I recommend you starting even earlier than that. You can also look into labor positions. Upright and side leg positions can help reduce pressure on the perineum during delivery, which may reduce your risk of tearing. And then working with your provider to practice laboring down and to avoid forceful pushing, which can reduce the likelihood of OASI. Even appropriate use of a medial lateral episiotomy may help your risk of not tearing straight back to the anal sphincter. Understanding your perineal length and how it relates to your risk of OASI can help you make more informed decisions about your labor and delivery. By measuring perineal length, your healthcare team can tailor a birth plan that minimizes tearing risk and supports a smoother postpartum recovery. I hope this video gave you some valuable insights into how you can prepare your body for birth. If you found this helpful, be sure to give this video a thumbs up and hit that subscribe button for more content on pregnancy and postpartum recovery. Thanks for watching, and I'll see you in the next one. And don't forget to check out the link in the description for my birth prep guide, where I share more tips on how to prepare for a smoother birth and postpartum recovery.